Issues at hand.
Welcome once again. This is Issues at Hand here on COU Family TV. We want to thank you so much. You who started with us and you are still with us. Now, today we are talking about something very, very important. Of course, the Nurses and Midwives Union a few days ago issued a 90 days ultimatum to the government to reinstate the internship program that had been waived by the Ministry of Health for upgrading nurses and midwives. So today we want to understand why the union is coming out to threaten the government, if I can use the word threaten, the government with a 90 days ultimatum. And what next if the Ministry of Health does not consider their ultimatum? Edrine Osteen Mukalazi is my name, and of course with us is Professor Kumakech from the Union of Nurses and Midwives. It's a pleasure having you this morning.
Thank you so much. My name is Professor Kumakech.
Yeah.
I am the president of the Association of Graduate Nurses and Midwives of Uganda. I come here in the capacity of the association, but yes, I'm also a member of the union.
Okay, so we are delighted to have you now that you're here in the capacity of the association, especially of graduate nurses and midwives. So we start from the background of this and why you have to come out to issue this ultimatum. So, of course, we know a few months ago, the Ministry of Health came out and issued this directive. I thought it came in good peace and after consultations from the union and the association, and I mean the entire stakeholders.
Yes, I wish to state that, Edrine, it is true, on the 20th of June this year, the Permanent Secretary, Minister of Health, Dr. Twine, Diana, sent a letter directing the Registrar of Uganda Nurses and Midwives Council to disaggregate, like segregate the list of interns, put the extensors, the upgraders separately from the direct entrants who came from A-level separately, because there was a committee that was called the Interministerial Committee on Education and Health that sat and resolved that they should exempt the upgraders from internship. And Edrine, this may sound nice.
Exactly.
But it's not nice at all to the profession and to the nurses and midwives. Why it is not nice is that, you know, nurses and midwives make up about 1 million of them, and they're about 75% of the workforce, health workforce in Uganda. Of these, about 1 million nurses and midwives, there are different categories. There are those who are holding certificate, like they finished senior 4 and then went for 2.5 or 3 years training, school of nursing, and acquired a certificate in nursing or midwifery. Then there are those who later on upgraded 2 years later to acquire a diploma. And then we have this group who later on even upgraded to go for a degree. Okay? But we also have another group who are coming from senior 6, who joined the university directly to join and study nursing and midwifery at a degree level. Now, so we have different categories of nurses. And in addition to the different category of nurses, we have different specializations. You find there are those who have studied midwifery, that is how to assist women to give birth safely and normally. And then there are those you may find have studied what we call general nursing. You see, these are the ones you see in the outpatient department, the ones you see in medical wards, surgical ward, in operating theaters. This is the biggest group. Then there are another group who study how to care for people with mental illness. We call them psychiatric nurses, those who work in Botabika. From them, all they have learned is how to take care of people with mental illness. And then We have even another group who study public health. Public health issues to do with the maybe research. They are not purely clinical. They don't work in the hospital. They are in the community, home visiting, health education talk, maybe giving immunization, and so on. So, because of this different background of nurses, especially at diploma level, when they go for degree, they don't keep their line. Some of them cross to a new line. You may find the one who has been a psychiatric nurse or a public health crosses to midwifery because now he or she wants to expand his or her knowledge and skills to serve the country better. Another one cross to another field. Another one cross to another field. And when they cross, they are exposed to totally new knowledge and skills which they did not have prior experience about. They are learning it for the first time. And many of these lessons are usually distance learning. You find some of them are receiving lectures through internet, online, Zoom, Google Meet, and others could be weekend. They just come to the school, to the university over the weekend, 2 days to receive face-to-face lectures, and then they go back. And when they go back to where they are working, they continue to remain in the field which their diploma can allow. Because the hospital cannot allow to change you. If you are a mental health psychiatric nurse, your diploma can only allow you to work in psychiatric unit.
Professor,
Yes.
At that point, I look at a situation where if maybe I have a diploma in general nursing, for example, and I want to upgrade for a bachelor's, and this time around I want to go now for midwifery. Can't I use this opportunity when I still have access to the wards to also go and see what happens in this other labor suit and all that, so that when I go for upgrading, I already have the practical elements in me?
Yes, that is the assumption. But in reality, in practice, that's not what is happening. Because when you are working, you are a worker. And you are being paid salary to do your job. Your boss at the workplace places you in medical ward and expect you to be there. And if you try to go to midwifery, they will say, no. You are going to make a mistake. Your duty is on the medical ward. So these extensors have been upgrading 2 days lectures a week or weekend or online. But their practice, when they were upgrading, remains that one of their diploma. And for that reason, we are saying these people should be given an internship training, which has been the law since 1999. People who train at a degree level, whether you come as a direct entrant from senior 6 or through diploma, you still have to go through a mandatory 1-year intensive training at internship training centers, which are usually these regional referral hospitals, national referral hospitals, or district hospitals. During that time, there are supervisors there to receive you, to supervise your work, to ensure you apply this new knowledge and skills you have acquired from the university. And they even assess you. It's not just an experience. They assess you midway, and they assess you at the end of the 1 year. And if your performance is still wanting, you can even be retained for another 6 months until they are happy that you have acquired competent skills that is going to be safe when they release you to go to the public and serve the public. Yes.
So that has been good. But have you also sought the ministry's intentions as to why they had to now put a stop on that internship?
Thank you for that question. We tried to analyze what exactly happened. We noted that in May last year, there was an interministerial committee meeting. It was Interministerial Committee on Education and Health. They held a meeting, and in that meeting, one of the agenda items that came up is that they should waive off this internship. And in that meeting, there was no representation of the professional associations. In fact, the only cadres of nurses which were there was the Commissioner of Nursing and Midwifery, who is basically a staff of Ministry of Health. And then there was a representative of the Nursing Council, of the registrar. And then there was a representation of the principals of health training institutions. But the professional associations for graduate nurses and midwives were not there. The union, the Uganda Nurses and Midwives Union, was not there. Pediatric Nurses Association of Uganda were not there. Emergency Care Nursing Association of Uganda are not there. The Psychiatric Nurses Association were not there. Public Health Nurses Associations were not there. So many of these stakeholders were excluded. And they made that decision that they are going to waive it off. And then they agreed that they are going to hold another meeting in July last year. But before they could hold that meeting, we got to learn of this issue. And as an association, we responded and said we have serious concern about the waiver. Because we also know some of these people who are upgrading are not necessarily coming from the hospital. There are those who are coming from research institutions where they are just doing data collection. Yeah? There are those coming from clinics, private clinics, where the patient volume is very low, the procedures are very limited. There are those went from pharmacy. There are those coming from community. NGO, they are just doing programming work, how to settle programs, manage budgets, M&E. And then there are those coming from education, teachers like me, who are not hands-on in the wards. So they are, and then there are those who have been off the system. You find somebody has taken a break and then say, now let me apply for what? For upgrading. So these people come from different backgrounds. So it is unfair to have a blanket policy which assumes everybody has skills and therefore they should be waived off. We are going to allow unqualified nurses and midwives to sneak into the public and start practicing, and they can be a danger to the patients and they can be a danger to public health. And that's why we have come up. So despite our response, on the 20th of June, the permanent secretary released the directive, and as I'm talking now, they have only deployed 456 nurses and midwives out of 2,174 interns who have been deployed. Only 400 are deployed. Over 2,000 of them have been left out.
Does this mean that it's only the 456 that are on fresh entry?
Now, these who have been deployed are the ones on fresh entry. Those ones who came from A level or diploma, but they went and trained as if they are fresh. You see, you can use your diploma and join the university and then train for the entire 4 years as if you are fresh. That universities have that program. So these 456 are mainly direct entrants from senior 6, and then very few diplomas who train as if they are direct entrants. But the majority, over 2,000, who came on what we call completion program, like they trained for 2.5 years, and their degree clearly shows Bachelor of Nursing completion or extension, Bachelor of Midwifery completion or extension. Those ones were all left and deployed. And some of them, they were even not deployed last year. So there is also a backlog of those who have stayed at home for 1 year or 2 years waiting for deployment. And they again missed it this year. The challenge they have, Edrine, is without internship, the current policy is you cannot be registered by the Nursing Council as a degree nurse or a degree midwifery. They want the internship certificate. Secondly, if you are applying for even upgrading to masters or postgraduate program, they are going to ask for the certificate of internship because they want to see you have done internship after your bachelor's, and then after the internship, you also have an additional 1 year of experience. So to us, this issue of waiver is not only going to affect the safety of the patients, but also affect the career progression of these nurses and midwives. It will even affect their employability. They may end up continuing to work as if they are diploma holders for the entire of their career. Internationally, the International Council of Nurses and Midwives, the International Council of Midwives, even many organizations abroad, internship is a prerequisite. And it is a practice in Europe. I can only talk of 2 or 3 countries where there is no internship. And the reason they don't have internship is very different. For example, US, America, North America, doesn't have internship. Why don't they have internship? It's because their training is highly specialized. If you are training as a pediatric nurse, it is just settled for that. It is not like ours where we are studying everything. You are studying as a psychiatric nurse, you are studying as a general nurse, surgical nurse, pediatric, everything is covered. Even UK, the people there, they don't do internship because their training is highly specialized. They have the first year, which is like a foundational for basic sciences. And then from second year up to the 4th year, you take your line. If you have chosen pediatric, you go that way. If you have chosen psychiatry, you go that way. And for that reason, they don't have internship. But Edrine, additionally, those countries have examination for registration. So you will finish your university program, you pass, graduate, and get your degree certificate and transcript. But if you are to be registered by their nursing midwifery council, they have a national exam that will be given to you.
Isn't the story with us here by the Uganda Nurses and Midwives Council? Uganda and Midwives.
We don't have that at the moment. For us, as soon as the students finish the degree, we receive a circular that you send the list of the graduates. The universities send this list to the nursing council, and then the nursing council only sees their provisional transcripts that they have passed, and then the nursing council sends this name to the National Intensive Committee, and then directors of hospitals come and start selecting who has applied to my hospital, who has applied to my hospital, and they pick. That's it. We don't have a national examination to confirm that these people, even if they pass their university program, they are qualified and experienced to be registered and practice. We don't have that at the moment. Then, Edrine, another challenge we have as a country is when these people are joining to upgrade with their diploma, some of the universities do not even have an examination.
A pre-entry.
Pre-entry examination is not there. And you know, most of these upgrading programs are done by private institutions, private universities, and they are after numbers.
Of course.
They want to get many
business,
students.
anyway.
Imagine somebody who is having public health, has been working in the community, or NGO, is admitted into a clinical program, and is just attending 2 days, and so on. So we have weaknesses in our system. We feel the waiver came so fast. It is rushed. At least they should have given the universities 5 years to phase out this cadre, the students we have admitted, including the first years, whom we have admitted without considering that they will not do internship. Because for us, we are admitting knowing that they will do internship.
There's a year of internship.
There is a year of internship. We also need to adjust the curriculum.
Okay.
Many of the curriculums are packed with theory classes. Very little clinical exposure. We want to teach everything. At the end, we don't send the students to many units. So we need to adjust the curriculum before we bring a policy that says people have no internship. So it is rushed without consulting many stakeholders, and we have not gotten a formal response from the Ministry of Health why they are waiving off internship. So,
Professor,
yes,
even at that point, as much as we've not gotten a formal response, but still, is there anything good in that circular that comes with this waiver? That okay, besides internship, are there any other recommendations that probably could come in the place of the internship?
No, it is not there. If
do they give a reason as to why the internship should be waived for upgrading students? I
have a video where the public relation officer of the Ministry of Health was responding to
Dr. Nwabini.
Yes, to NBS TV. Why they are waiving? He was saying for them they think the diplomas already have clinical experience.
That's what we all think.
And so there's no need to resubject people with clinical experience to another internship. That is what he says.
How about if it is the people, the nurses and midwives that you people are dying for, complaining to the ministry that after having this internship at certificate or diploma level, again I'm supposed to be subjected to another internship, doing the same things? Because I think it only happens in your field. Elsewhere, still it's the same story. If you're upgrading, you don't need internship.
No, you see, the challenge is the nursing field is highly specialized. It's really highly specialized.
How about if it is the nurses complaining?
Yes.
Have they complained to you about the same before, especially over that 1 year of internship that they have to be subjected to before they qualify?
You know, as soon as we saw that policy from the Ministry of Health, we held a general meeting that was attended by over 400 nurses and midwives. The general consensus there is they want internship. They want internship. There are a few voices who are saying they don't need internship. Yeah? And when you ask those who say they don't need internship, they are complaining about the poor supervision where they are placed, and the fact that the internship training centers, some of them where they are placed, are not busy. They are like exactly where they have been. There are no degree nurses and midwives to supervise them and help them learn new things. They are taken as workers. But to me, and to us as an association, that is an issue with the implementation of the internship training. You know, it does not waive off the need for them to learn and practice. It is like the house where they are posted, the hospital where they are posted to practice, is not well prepared to receive them and help them learn. And why are they not well prepared? It is because the same Ministry of Health have refused to employ the degree nurses and midwives, the ones who have qualified, and place them in those hospitals to receive these interns and mentor them and supervise them. So you know, it is like merry-go-round. You refuse to employ the degree holders, and then you pick people and place them in hospitals where they are diploma holders, and then this is a degree intern says, but now this is a diploma holder and I am a degree holder, I am more qualified than him or her. What is he going to supervise?
But this person is more experienced than you.
No. You see, the things they learn at the university is very different. If I'm to tell you the curriculum of a certificate nursing or midwifery, compare it with the curriculum of a degree nurse, they are completely different. And even the thing they're supposed to practice is supposed to be different. Now, I don't want to be misunderstood that I'm insulting, for example, certificate and diploma. Now, the certificate and diploma are trained to work like robots. Okay? Perform the procedure, hand it over to the doctor to make the decision. Take the blood pressure, take the weight, take the height, and here, doctor, here are the findings. They are not trained to interpret these findings and make a care plan or a decision of how can I care for this person in a way other than the medicine the doctor prescribes. For us nurses and midwives, the medicine the doctor prescribes is just one of the interventions you are supposed to do for the patient. It's one of the items in the care plan. You may have issues to even help educate this person. You have issues to counsel. Maybe you have to give the drug. It's just one of the things. Maybe there are issues of hygiene. You have to bathe this person. Maybe the family members are having issues. You even have to do this. So for us, the prescription from the doctor is just one of the care items that the nurse has to attend to. There are many things we care for and care about the patient and the patient family, including the environment this person is in. So the diploma and certificates are just trained Take blood pressure. They take. Here it is. Take the weight. Here it is. They don't intervene until the doctor say, okay, I have looked at the findings. This is a blood pressure patient. You give this anti-blood pressure medicine. And then they give and they end there. You see? Yeah. But the degree nurses are trained beyond that. They are trained to practice even as, and we call them nurse practitioners. Somebody who can receive a patient, can assess the patient, can come up with even diagnosis and say this is the first line treatment I can initiate for this patient, plus the nursing care, and then move the patient to the next level. Either go and see a doctor. If a patient comes, is maybe bleeding and so on, they are trained quickly to prioritize that this is high-risk patient. I must first stabilize this patient and do this and that before I send this patient to the doctor. It's not like a patient comes, doctor, come and help.
Professor, of course, there's been that misconception that any female, even if they're a doctor, you see is a nurse, and then any male you see, and these days the nurse is also put on the clinical coat. So, I mean, it confuses us, the patients. But we are taking a short commercial break. When we return, we are going now to understand what happens if the 90 days pass and the Ministry of Health has not reinstated the internship program for the upgrading nurses. What are they planning to do? We are coming back shortly.
Issues at hand. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission.